All right. Hey, good afternoon and welcome everybody joining us online for our fourth virtual chat on COVID-19 with healthcare professionals all over California. Today, we are honored to learn from Dr. Ronald Luu, a very experienced and passionate emergency room resident doctor who is also an alumnus of Beckman High School. Our virtual podcast today is brought to you by the Medical Certificate Program of Beckman High School in Irvine, California. We hope today's conversation will be educational for whoever is watching, and that throughout this virtual chat series, students can tune in anytime to get further educated on what's happening in healthcare right now. We have decided to collectively start a new format. If you didn't join us for our third seminar, there is a YouTube live chat box for those of you viewing on your laptop, in which you can ask us a question in real time. So without further ado, let's start by getting to know our speaker better. Well, welcome, Dr. Luu. How are you doing?
Hey, Philip, how's it going?
Hey, great. Oh my gosh, we've been friends for so long. And like I told you, may this chat just be a conversation between us two. And hopefully our students can get a lot out of your wisdom and your knowledge.
Yeah, right. Sounds great.
Awesome. Hey, so can you start off by introducing yourself? What's your current role? And just tell us a little bit about your personal life.
Sure, yeah. So my name is Ronald. A lot of people call me Ron. I am currently a third-year emergency medicine resident at a hospital down in South LA. Grew up in Orange County with Philip, known Philip for pretty much my whole life that I can remember. Went to Peters Canyon Elementary School, Pioneer Middle School, graduated from Beckman, and then went to UC Irvine, where I majored in biomedical engineering. Then I went from there, I went to UCLA for medical school, and luckily enough, stayed in Southern California my whole life, where I have lived and stayed close to my friends and family for pretty much my whole life, and it's been great.
Wow, that is so awesome. And I think what's really unique, Ronald, about you and us interviewing you is you literally sat in the same seats that our students are currently sitting in at Beckman. Hey, did you ever think that you'd end up where you're at? You've always been driven, you've always been ambitious, you've always been a hard worker. But did you, looking back at your life and all that you've accomplished at such a young age, did you ever think you'd end up here?
Oh man, I don't feel young, It's been a lot of years in school, and the short answer is no. It's been a long road. It's been a lot of school. Feels like I'm still training, and I'm still always learning day by day. And it's hard to imagine where I am today. That's all my friends and family, parents that support me through the thick and thin and all the troubling times. And it's been a long time, but it's good to kind of reflect back and see where I've been, and even talk to Beckman students, kind of going around full circle and help support the future. I think that's a really important step and something that I hope to do for the rest of my life.
Wow, encouraging. Hey, one of the questions we have for you to start off this interview is just, how are you doing? How is the life of a resident in LA, especially a resident emergency medicine physician? How is that going for you right now?
Man, it's really different. The past few weeks, months have been changed a lot. It's been really high stress. A bunch of emails, reading a bunch of papers, trying to stay up to date on everything that's going on. It's hard to keep up with something that's changing day by day, with different professional societies updating the recommendations daily. It feels like it's hard. I will go to sleep after a night shift, wake up, and my parents will tell me something they read about in the news, which is more up to date than me, because the news is staying up to date with everything that's going on. It's crazy to see something that you do in your daily life and your work job translate to something that's a hot topic that everyone is talking about. But it keeps things exciting, and it keeps things interesting, and it's something that keeps me up at night sometimes. But it's also exciting, and it's great just to help patients in their time of need.
Yeah, from as long as I can remember, you've been watching, hospital shows and doctor shows and all that growing up. So for the students at home who don't quite know what the emergency room is like, can you to the best of your ability, explain kind of what it's like on a day-to-day basis, what kind of norm. Yeah, so let's kind of talk about before COVID versus after COVID, and let's talk about what were some major cases that you were dealing with before COVID, and now what do you see more of right now in the emergency room after COVID?
Yeah, it's a really deep question. I mean, there's multiple layers to that. It's really interesting, actually. Before COVID, it'd be your heart attacks, appendicitis, people coming with chest pain, abdominal pain, kind of broad things. And after COVID, all these things that with every public health official and the government saying, stay at home, only go to the hospital in case you're in emergent need, and people getting just being scared that going to the hospital will put them at risk of contracting COVID. People are staying home, and it's kind of crazy. There's studies showing that people aren't having heart attacks as much anymore, which is crazy to think. It's probably not true. People are probably just staying home, and which is kind of scary to think that people are just dying at home when they really should be presenting to the emergency department. And we are seeing lower volumes overall because people are staying at home, and the people who are showing up are having short of breath, are very ill, and a lot of people are end up being diagnosed with COVID now. So it's pretty much our differential for every patient. Every patient has COVID until proven out otherwise, and it's totally a game changer. That's something we used to never even think about. Now it's kind of on our daily differential for every single patient.
Awesome. Hey, one of the questions that our students have right now, I'm going to read this off my email, is let's see here. What is the procedure for a person who comes into the hospital with COVID-like symptoms? So especially like if they come into the emergency room, kind of like what's the protocol from your point of view and on how you treat them?
Yeah, so depends on how they come into the hospital, first off. So yeah, usually if they're really ill and they're coming in by 911 by the paramedics will usually call our hospital, give us a heads up, and that gives us a great amount of time to prepare. Pretty much every patient now, we're wearing protective equipment, at least a mask and eye protection. For me, that's usually wear goggles. And if they come in short of breath and we require some oxygen therapy, usually we'll kind of go more than that. We'll wear a gown, double gloves, N95 mask, and maybe even a higher tier protection that involves like a whole fan and goggles and a whole helmet kind of situation. But we pretty much our priority now is protecting ourselves. And that's the main thing, because a lot of healthcare workers are getting sick nowadays, and we see that from other countries, from the other countries' experiences in Italy and China. And healthcare workers, we got to think of them as kind of a scarce commodity, and we have to protect ourselves before we all go down with illnesses and we can't help our patients. So that's one of the key things, is really protecting ourselves.
Wow, well said. So another question we got here is, what's your current schedule like? And can you also share with our students how sometimes you're staying in a hotel room? Yeah, so talk about that whole thing and how a lot of healthcare professionals are using that option right now in LA and maybe other impacted cities.
Yeah, so first, my schedule, it's, emergency doctors work shifts. So, for example, the past 3 nights I've been on the night shift. So I just slept and just woke up for this. So now I'm going to switch back to days. My next shift will be in 2 days, will be in the morning. So my schedule is kind of all over the place depending on what shifts I work. I generally work about 4 to 5 shifts a week as a resident. Residents work a lot. So generally it's kind of maybe 18 to 22 shifts a month. So we're definitely in the hospital long hours. The second part of the question was, what was that again, Philip?
Yeah, so the second part of the question was the hotel room.
That's right. So it's crazy now. A lot of the community is reaching out, helping frontline workers, and it's been amazing how much support we've been getting. And for example, the Hilton, Marriott, a lot of different hotels, Airbnbs are offering free rooming and housing options for healthcare workers. And I've chosen to do that whenever I work 4 to 5 shifts in a row. I will choose to stay in a hotel. And that's mainly because I live with my family and I don't want to expose my parents. That's really the main thing. My parents are at an age where they're at higher risk. And I've seen a lot of patients who are my parents' age become very ill to this disease. And that's not something that I want to or see them go through. So I choose to minimize the risk to my parents by staying in a hotel whenever I can to make sure I can decon there safely and basically keep them healthy.
That's awesome. Thanks, Ron. So I got two more questions here before I open it up. I'm seeing the questions coming from YouTube Live. Super excited to ask them. But a question I have is, so your mom is one of the best cooks I know in the world, right? Growing up, I was a lucky recipient of that cooking, especially those cakes and just really all the food that she cooked. How's your diet right now as an emergency room physician? And talk about exercise. What are some ways that you're able to stay fit through this pandemic?
Yeah, sure. Diet, yeah. My parents cook for me a lot. My mom is amazing cooking, as you said, as you know, and it's hard now. You know, I'm spending a lot of hours in the hospital. Luckily, again, the community is very, very nice right now and very supportive of all the healthcare workers. So we're getting a lot of food donated to the hospital. It's been great. I probably eat a lot more and a lot unhealthier at this point. I'm eating a lot of food outside. But I say that I'm pretty well fed. You know, even though I'm staying in a hotel here and there, I free food. That even though it is unhealthy, you know, McDonald's are giving away free food for a while, and then now Lee's Sandwiches is giving free food. It's a lot of food that I usually probably wouldn't eat normally. And when your schedule is tight and you gotta wake up to go shift to shift, it's what kind of carries you through.
Yeah.
In terms of staying healthy, exercising, you know, I like to go to the gym, and so it's hard for me to work out at home. So with all the gyms closed, it's hard to keep up. I usually like running, and it's been kind of tough keeping up with that schedule. I've made a little home gym, so I'm trying to do what I can to stay fit and not trying to gain that COVID-19.
Wow, awesome. Hey, in case your parents are listening right now, Ronald,
Sure.
what do you want to say to them? What do you want to say to them for all that they've done? Come on, let's get to the heart. Come on, man.
Well, they know that I love them, and you know, they appreciate all their support for me. And even though these times are trying, and I'm, you know, trying to keep my social distancing from them, keep from being ill. Yeah, I hope they know that I love them and appreciate all they do for me.
That's awesome. Hey, I also want to touch on this. Dr. Lou, your wife is also a physician as well, a very good physician.
Right.
May I say, on the East Coast, and she's finishing her residency right now. Can you give us a little update on her? How is she doing, and how do you keep a husband and wife doctor duo going, right? Especially during a pandemic when there's so many restrictions. So, what are some tips on keeping a successful marriage?
Yeah, you know, Flan's watching, love you. It's hard, you know, we're long distance right now, so it's tough with all the travel restrictions to see each other. But we try to, you know, talk to each other webcam when we can. And I worry about her all the time. You know, she's still seeing patients in the emergency department, and I'm seeing consults in patients clinic, and it's hard. I can't imagine if she were to get ill, you know, being across the country. That's something that I worry about every day, and it's hard. But we try to keep up with everything, try to educate each other, try to keep each other safe, remind each other to always wear protective equipment, and that's the most we can do. Just be supportive of each other, and that's really what's going to keep us through and keep us through this pandemic.
Wow. Hey, one of the questions here from YouTube Live is what would you say, Dr. Lou, is one of the best qualities to have in a doctor, especially one practicing in the emergency room? If you could pick, and if you can't pick one, then go and go with two qualities, but what would you say?
Oh man, there's so many things. I think it's really hard to pick one, but I think one of the things that comes to mind would be being compassionate. You know, as a mercy doctor, you're seeing patients in their time of need and when they're most vulnerable. And a lot of patients will disclose a lot of very personal things to you. So compassionate is something that it's hard to keep up, you know, with all these patients that you see, especially a lot of people dying and talking to families. It's that's something that we got to remind ourselves to be human, and that each patient you see has their own story. And that's something I try to remind myself every day, because you can't forget, and it's easy to forget.
Yeah. Hey, so for those who don't know, Dr. Luu, how long is your residency for emergency medicine?
Yeah, that's a great point. So, after high school, I graduated from Beckman. I went to UC Irvine. That was 4 years, and then medical school is another 4 years. Then with that you get your medical degree. Then you have to choose a specialty you want to subspecialize or train in, and that's what I'm at right now. And so, different specialties have different required years of training. Emergency medicine is generally 3 to 4 years. My particular program is 4 years. After in July, I'll start my fourth year. It's my last year of
Oh, awesome. You know, the standard work week for all Americans is usually 40. 40 is usually what we compare everything to. As a resident, kind of what would you say the range of hours is typically for you?
Oh man. Well, for us, more recently, we have hour restrictions that wasn't used to be there. Now our hour restrictions is 80. So you're discouraged to work over 80 hours, but it's very common to get very close and often, and sometimes for some specialties, work over that, especially our surgical subspecialties. For me, right now, being in the intern year, I probably worked around 60 to 80 hours a week. Yeah, you go in through residencies, you get a little more seniority, you work a little less. So currently, I'm probably working around probably average 50 hours a week.
Okay. And is there any overtime in residency, Ron?
Oh no. Oh, I wish there was, but no, you just work and work until and you just get a salary paycheck.
Wow. So here's another question, and I'm going to say his name from Jonathan Doe from YouTube here. It sounds like you're very busy, Ronald. What are some tips you have for all of us in terms of balancing your work with your personal life?
Oh, that's a great question, John. I'd say it's I'm not the person to ask. Probably, I have trouble even meeting deadlines sometimes and working on papers. For me, what I learned the most important thing was learning when to say no. I'd say back in college, I was a yes man. I was like, yes, I want to do this. I want to pick up this leadership position. I wanted to do that. And it was all about saying yes. And eventually, I had to learn how to say no. And when that was healthy for me and maybe more beneficial, so I could focus and really tune into certain things in my life that was turned out to be more important for me. So I think that's one of the things that you have to learn to kind of balance when you're young and you're offered a lot of really enticing opportunities. You just got to kind of weigh the risk and benefits and learn when to say no.
Here's another question from YouTube Live. Dr. Luu, how do you handle going back home after being in the hospital? Do you quarantine yourself? So how do you, what's the protocol when you go home to go visit your parents or something like that?
Yeah, I think that's where the hotel situation kind of helped me. I think every emergency doctor and nurses, RTs, all the hospital workers are coming up with their own decon methods, which is something we used to probably no one used to probably do, or very few people, I'd say. But now, I don't bring any scrubs, dirty scrubs into the house. I bought new shoes for work. My gym shoes used to be my work shoes, and now I've learned that that's probably not the safest thing. So I had to buy new shoes that I could wipe easily, and like a waterproof shoe. Um, and yeah, so I will take off like all my scrubs, before I even enter my car. I change my shoes. I wash everything. My residency program bought like a UV light decon machine where I put all my stuff into and I radiate everything and just trying to be as really clean as possible and not try to bring any bugs home. That's really the goal. And the hotel really helped with that as a kind of intermediary, like between home and work, where I could shower there and change and leave all my dirty clothes in one kind of area and clean clothes. And it's something that I'm much more mindful of where I used to not be.
Wow. Here's another one. Hey, Dr. Luu, what is the biggest challenge you encounter on a day-to-day basis, and how do you tackle that?
Oh man, day-to-day basis is really just keeping on my mask and goggles at all times. It's hard sometimes, it's really what we're learning from the countries is you're really at risk of contaminating yourself when you're taking off protective equipment, right? So and it's hard to go 10 hours without eating, drinking, rubbing your nose, rubbing your eyes, um, scratching your nose. It's hard. So I really try to learn how to not do any of those things, not to take off my mask, not take off my goggles whenever I can. Fogging is a big issue with the goggles. It's something that we're all dealing with, and we're all trying to learn how to adapt to, because it's tough. But going through those trivial things is what we have to do to stay healthy, and that's on those little troublesome things is what's going to keep us on the front lines to help our patients.
Here's another question here. Dr. Luu, how do you transition so easily? That's what it says, so easily between night and day shifts.
Ooh, I wouldn't say it's easy. I'd say a lot of people have their own routines. I, there's some tips and things that people recommend. For me, it's sleeping during the day is tough, but you really have to get like a really dark room. So I have blackout curtains in my house. I have a fan on most of the time when I'm sleeping at home. You've got to really take a cool, dark environment to sleep during the day. And when you're transitioning, for me, I try to minimize the sleep after a night shift. So like just now, I slept for maybe like 5 hours. I'm going to try to stay up the rest of the day so I can sleep tonight. That's really the goal, to try to get my rhythm back in order, so I can go ready for the next day.
Wow, awesome. Thanks for sharing that. Here, how did you know that emergency medicine was right for you? Kind of what was the process, Dr. Luu? So what process did you take to kind of figure out that of all the specialties out there, emergency medicine was right for you?
Yeah, that's a tough one. I think for me, my first exposure to emergency medicine was actually volunteering when I was in high school. In high school, I volunteered in the emergency department when I was very young. I didn't know at that time that that's what I wanted to do. That's what my first exposure was that. So I think that's something I recommend to a lot of the students listening is to go out and try to volunteer, take this time to expose yourself to medicine and what it's really like out there, and outside of a clinical role to just see if it's something that's for you. And then from there, I didn't really choose emergency medicine, and even know I wanted to go to medical school until college. I was kind of entertaining the idea of being an engineer for a little while, and then once I became or chose to go into medicine, wasn't really until medical school or what's going through my clinical rotations where I really decided that emergency medicine was for me. Originally, I was thinking about being a surgeon and being in the operating room, but I quickly learned through my clinical rotations that I didn't love the operating room as much as I thought I had, and I actually liked the breadth of emergency medicine, still practicing medicine and doing some procedures here and there, and helping people in their time of need. I had my own emergency room experience, as I'm sure Philip remembers, where I broke my collarbone from track and field. So that's another story from another time. But that's one of the experiences that helped me shape and choose my career.
Wow. So I'm getting this question right now via YouTube. It says, I know becoming a doctor takes a long time and it requires a lot of effort and a lot of money. For the students who are listening, Dr. Luu, who are interested in becoming a physician like you, or maybe even a different specialty, or going through the medical school process, kind of what is your best advice for them? Because this decision shouldn't be taken lightly, as you know. Like there's a lot that 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 a lot of students maybe in high school don't know. But just what's your best take on that? And then really the question here at the end is, do you regret making any of the decisions that you made throughout your process of becoming a doctor? All right, go for it.
Yeah, it's a great, really deep questions with a lot of layers. I would say I don't regret anything that I've done in my life, so far. I think everything has been working out pretty well. Choosing medicine is a tough choice. As we said already, the sacrifices of just the length of schooling. A lot of my friends who I was engineering majors with me are all out there making money right now for years now, even, and it's hard because I feel like I haven't even started my career yet and gotten like a full paycheck as being a physician. Yeah, in residency you do get paid, but it's not as much. You're just getting paid uh, from uh, from the residency programs. Just get paid by the state and by the government, so it's rough. So there are a lot of financial and time constraints and a lot of debts to pay. So it's hard, but I'd say the biggest thing for me was having a lot of mentors. throughout high school, throughout college, people who've done it, people who were just above me, a few years ahead of me, who were going through, already did what I wanted to do, and going through them and talking to them and getting advice from them was really, really helpful for me to figure out that that's medicine is what I really wanted to do. So that's one of the advice I would give is finding a mentor. And I'm not saying mentors who are already like, if you're in high school now, not finding a physician, finding like someone in college. If you're in college, finding someone in medical school. And when you're in medical school, finding someone in residency, just that next step, and someone who just did it so they can really connect with you and remember what it's like. Because even now, like I don't even know what applying to college is like now. It's so much has changed. So that's one of the biggest advices that I would give.
Well said. Hey, I'm getting some questions here about debt. All right. So,
Okay.
to give an accurate portrayal, because of course you can Google all these numbers,
Yeah, definitely.
the person who has gone through the process, especially here in state schools, and you don't have to share your own numbers, but just in general, what are some finances that people should be prepared to invest when it comes to medical school and or even just talk about it private versus public and just your experience on that.
Yeah, that's a great question. Of course, you can look up, and I do recommend you to look up all these numbers online because that is something that is it's staggering. Some of the numbers you'll see, especially for private schools. Most private schools going to medical school by itself is about 70, $80,000, including boarding. And fortunately, I went to a public school, which is still a lot of money. It's about $30,000 to $40,000 a year. So it's hard. You're gonna be taking on a lot of loans. You're gonna be spending a lot of years to pay those back. But I would say, medicine's not the career to choose if you want to make money. If you want to make money, go into business, go into finance, go into those other engineering, even to make money. But being a doctor is not just about making the money. It's really about helping people, and that's really what it comes down to: helping and teaching people about their disease and getting them through and keeping people healthy. 'Cause that's really what it's all about. And it's not about the money. Money is, if you're going to be really unhappy if you want to make money and you choose medicine as your career. I'll say that.
Especially in the short run, right? Because in the long run, it's an investment. And I'm sure it's gonna,
It's
have that.
investment, yeah.
Yeah. So, here's another question I got here. What is your best advice for the general public in terms of protecting themselves and avoiding this sickness? Put it another way, do we need to do much else outside of our usual cold and flu prevention strategies, such as regular hand washing, getting rest, and drinking fluids, and staying at home? Just anything else other than those types of strategies? Like what is your best advice on that?
Yeah, and I'm not the expert in that. That's really the CDC and public health officials. But that's really all the guidelines you're hearing is really the way you're going to stay healthy. Staying at home, only going out when necessary, and washing your hands frequently, not touching your face, wearing a face mask when you're out in public when you have to go outside. That's really the key. And it's a hot topic in the news. Whenever someone goes out and people are in crowds, it's news because that's what's going to keep us in this pandemic. People are going to get sick. When people go out to mass gatherings and hanging out, socializing, even just going to a friend's house for dinner. It's really exposing yourself and your loved ones to COVID. And really, the prevention is key in this. To really keep people healthy and not collapsing our healthcare system.
Wow. So here's another question I'm getting via email right now. Did Beckman prepare you for what you had to go through when it comes to undergrad and or medical school? And what surprised you about medical school in particular? Like, is it as hard as what people always say?
Yeah, I do believe Beckman prepared me. This is years ago. This is when Beckman just first started. So I'm sure Beckman's way better now, especially with Philip Chow as your teacher. I'm sure Philip is doing a great job teaching our future professionals and being prepared for college. But at that time, even back then, I think Beckman prepared me for what I was going to go through. And it's really not even just about Beckman per se and the teachers I had which were all great. It's really a lot of the onus is upon yourselves. I think a lot of people do great and a lot of people fail, and it's half of it. I think you got to take your responsibility for yourself to study and find your way of learning. And I think that's one of the key things I tell a lot of people. is school is really a way for you to practice time management and find your way of learning, finding how you learn effectively, time effectively, and just to minimize, going back and reading the same thing over and over again. And that's one of the things that you learn in high school, and you try to tune that in college. And then from college, balancing all those different classes and midterms and finals is again time management and finding an effective way to learn. And that's what helped me eventually do well in medical school. Uh, that's what it's all about, just finding your way to learn, an effective way to learn. And medical school, what was the last question? The last part of that question?
I believe the last part of the question was, is it as hard as?
Oh, yeah.
Yeah.
A lot of people will say medical school was like drinking out of a fire hydrant. It's a lot of information all the time that you're only going to retain a little bit of it. And it is hard, but in some ways it's easier because in college you're balancing 5, 6 different classes. In medical school, everyone's all on the same page. You're learning about one subject at a time. You're taking one test at a time. And it's subjects that you're actually interested in. So in some ways, it's more interesting and it's a little bit easier when you're more invested in it. But it is still very difficult.
Wow, awesome. Hey, so it's AP season because and you've taken a lot of APs. We've taken a lot of APs in our life. Looking back, because you've always been on this kind of fast track for medicine, and you've always been passionate about medicine. Grades matter, right? Or grades matter to us.
Definitely.
What is your advice to students as they go into AP season? And what if they fail? Yes. What's your best advice and encouragement when it comes to these tests in high school that we thought were really a big deal? And how do you kind of see them now? And what would you say is more important than maybe even passing the test?
Yeah, that's a great question. It's funny. Yeah, everything is such a big when you're there and you're at it. That was the biggest thing for you. And you look back at it, it's like, well, maybe it wasn't such a big deal. But I still, even with that said, I still recommend, taking it seriously, studying hard for them because passing those APs made it easier in college. Because I got a lot of credits in college from APs, and it put me ahead of the line for signing up for classes. So there's a lot of advantages, a lot of pros for doing well in the APs. But the main thing is to, again, learning how you study and how you learn effectively. Whether that's reading a textbook, doing flashcards, writing things down, taking notes, highlighting your book. It's really about trying to find your effective way of learning. And that's what's really going to translate into your future learning. And it don't matter even if you do fail, it's more about, okay, maybe that wasn't an effective learning strategy for me. Now I got to try something else and trying to do different things to keep yourself ahead of the game.
Wow. So Dr. Luu, you decided to major in biomedical engineering, which I want you to talk about in a bit. Now, from what most people don't know is there's not a pre-med major. Most people major in biology and or chemistry because those are two majors in which you can meet all the prerequisites to get into medical school easily with. That being said, can you just briefly talk about your experience? Why did you choose biomedical engineering? And just all that. Go for it.
Sure. Yeah. What made me choose biomedical engineering in the beginning was I was really interested in prosthetics and learning how to make medical devices in general. But still, maybe had that inkling of still doing medicine with my volunteer hospital. So the biomedical engineering field is a good mixture of both that I thought would be a great major for me when I first started out. I actually went into UC Irvine as a biology major, but the summer before starting college, I switched majors to biomedical engineering. And so that was my major kind of thought process on choosing biomedical engineering. I was like, maybe I could fall back on medicine, but I was kind of more interested in engineering. And then as college went on, I kind of slowly figured out, medicine was really for me instead of just doing engineering, which I still have interest in making medical devices, but medicine is what I wanted to do in practice. So really, you can choose, as you said, you can choose any major. A lot of my medical school classmates were from history, different languages, and they majored in. They weren't all just from the sciences, and that actually kind of makes you a little almost more interesting as an applicant for medical schools because you can kind of twist and turn your kind of personal statement and kind of do things, you're a little different than your average science major. So I know a lot of my friends who were different majors when they were back in college. So you can really do whatever you want as long as you still do the pre-medical record or pre-med requisites, and that's it. Uh,
Wow.
yeah.
Hey, so UCLA is a big deal in terms of medical school, in terms of their acceptance rate. So I want you to kind of speak into our students who are listening right now. If they are interested in medicine and they plan to follow your steps of going through undergrad somewhere and then maybe applying to medical school, what is your best advice? Because I know it's a very competitive process. Um, well, I guess the question is it as difficult as everyone says it is? And the second question is, what are some things that you would say applicants can do to kind of set themselves apart and really get admissions in? What do you think matters the most when it comes to that medical
Yeah.
school?
Yeah, that's tough. I think medical school is really hard to get to. UCLA is very hard to get to. I don't think I think I got lucky, honestly. I'm not sure how I got in, and it's a hard process, man. I probably wouldn't get in if I applied today. Every year, I feel like it's getting more and more difficult. I was on the admissions committee when I was a medical student, interviewing applicants, and some of the applicants I saw were just amazing. And it's hard to choose, man. There's a lot of amazing people out there, so it's tough. And even that said, even me being on the admissions committee and interviewing applicants, I still not really sure like what's the key. I don't think there really is a key. It's really UCLA really emphasizes and really likes applicants who are well-rounded, who do a lot of leadership, who are very mature for their age, and have a lot of outside experiences outside of just medicine and doing research and doing volunteer work. They value a very well-rounded applicant. I think that's one of the things that UCLA really puts ahead. Um, Separates that UCLA Medical School from other schools. Are my class and all the people who I know went there are very well-rounded and very great and empathetic and courageous people. And I think that's one of the things that they value.
Wow, awesome, Dr. Luu. Thanks for your wisdom. So I got another question here via email is, Dr. Luu, what if I apply to med school and I don't get in? Would you suggest we keep going? And at what point would you say stop?
Yeah, a lot of people don't know this about me, but I didn't get in either. And it took me some time to get in to go through the medical process, the application process. And I think reflecting back, when I applied the first time, it was I probably wasn't ready. Um, didn't have all my extracurriculars in order, and didn't have great letters of recommendations. And a lot of people, and for me at that time too, I had this idea that I had to go straight through. If you're going to go straight through, you have to apply during your junior year of college, and after you graduate college, just start medical school. So I think that was too early for me. Honestly, I wasn't ready. I didn't have all my board scores, or my MCAT score wasn't uh, the best that it could be, and I did apply too early. And I guess when I reflect back at it, that's what I learned. So I think if you do apply, you don't get in the first time, keep going. If you really think medicine's for you, to don't let that process stop you from this lifelong career. That's very rewarding. You have to just reflect back and review your application, and have mentors look at your application and see what you can fix and what you can do better in the future, so you can make yourself a better applicant for the next round.
So yeah, so if you look at the ages, like we got out of high school at 17, 18, maybe.
Right.
4 years later, you were what, 20, 21? What would you say? Okay, so 2021. What would you say is the average age of your cohort, your
Yeah.
UCLA medical cohort of new medical school students?
Yeah, there's probably is a number out there. I don't know that number exactly, but I want to say it was maybe 25, 26. A lot of people change careers, have a different career and change the medicine. A lot of people take time off after college. Some people do go straight through. I do know some of my friends who went straight through, but a lot of people do take time off, to research, to really just take that time to strengthen their application. It's hard to go straight through, and I think now, especially in these days, it's almost too difficult. It's almost impossible, I'd say. but people still do it. People who are ahead of the curve and know what they want to do and have everything in order can go straight through. But I wouldn't discourage people from taking time off if it's too much.
Okay, so here's another one from YouTube here. Hey, Dr. Lou, this is so inspiring. Thanks for the awesome words. It's pretty much when you were in medical school, how were you able to balance your relationships and your education? So for those of you who don't know, Dr. Lou has been dating his wife since undergraduate at UC Irvine. Now, when it came to applying to medical schools, they actually went to different medical schools during I believe the same year. Is that right, Dr. Lou? So can you talk about that? And what are some things that you did to kind of stay together and to stay strong throughout this kind of long distance relationship?
Yeah, long distance is tough. Even with all the video chatting and technology we have nowadays, it's hard. It's something that you really have to commit to and really put yourself and dedicate yourself to. So it's hard, studying. I think almost in medical school, it was difficult, but made it kind of balanced that we were both very busy studying and we could study together and web chat with each other, and video chat was just studying with each other. We just whatever time we could to spend time with each other, making an effort to communicate, whether that's by text, video chats, whatever we could do to keep in contact with each other, and also just making it a point to know when we're going to see each other next. I think that was one of the very important things that we did, is always had the next date. When are we going to see each other next? When we're going to fly to do whatever, or go on vacation, or travel. And I think that's one of the main things that kind of kept us through and kept us strong.
And so for all of our high schools out there, Dr. Lou, what is your best advice to them? Let's say they have free time, and as COVID kind of comes to an end, hopefully at some point, but when our students have free time, what is your best advice for volunteering and or getting experience and or things like that? Now that you know what being a physician is, looking back, maybe what is some best advice that you'd give to high schoolers, or maybe even people who are getting into college right now in terms of getting experience?
Yeah, getting experience in the medical fields. I don't know what it's like to be a volunteer in the medical field right now. I imagine it's pretty stressful, and they're probably limiting a lot of what volunteers can do in the hospitals. But that's one of the things I'd recommend. That's one of the things that really helped me when I was in high school. It's gonna shape my career, is to go out there and try to put yourself out there to work at a hospital, but go volunteer, go put yourself in the places where you think you want to be in the future, whether it's in a surgical office or clinic or a nursery room. Out there and put yourself in that position, um, or try to volunteer, try to take up leadership positions, whatever you can do because you're also a leader, and being a physician, you're also a leader of your team, and you have to learn those leadership skills sometime, and the earlier the better, I'd say.
Awesome. Hey, I'm getting a lot of questions in right now as we close. Thank you so much, everyone, for your interest. If we don't get to all of them, please email me or contact me, and then I can contact Dr. Lou. Hey, but as we finish off, we got two more here. The first one is, Dr. Lou, can you share with us which specific specialties, medical specialties, directly contact and or help COVID patients? So as people with COVID are coming into your hospital through the emergency room, kind of like what are the specialties that are directly dealing with COVID and really are doing a lot right now during this pandemic in the hospital?
Yeah, so not only doctors, right? I mean, emergency doctors, sure. Nurses, sure. There's also the respiratory therapists. There's the EKG techs, the X-ray technicians, the LVNs, the nurse assistants, clerks up front. There's a lot of staff in the hospital that keep us up and running. And outside of the emergency doctors, there's the intensivists, the ICU doctors, pulmonologists, the internal medicine physicians, family medicine physicians, and it's a whole team of doctors to take care of a COVID patient. I mean, there's so many people that it's hard to keep up. So it's tough when I see that a lot of companies are thinking just doctors and nurses. There's so much more that keeps patients healthy and keeps the hospitals running.
It's awesome. Hey, by the way, Kapil and Kevin Herrera say hi on YouTube, so they're on. Yeah. Hey, so 5 words here. When I teach at Beckman, it's so awesome. It's so unique because it's like I'm talking to my younger self. So as you're talking to this audience of Beckman students, like, what is your best advice for your younger self, Dr. Lou?
Oh man, that's tough. I'd say you just gotta keep smiling every day, keep a positive attitude, just like resemble Philip Chow. Yeah, Philip Chow is the goal, and you should try to put yourself in that position, have that mindset of just like Philip, keep a positive energy. When you're young, it's okay to be a yes man and do go out there and put yourself out there. That's really those life experiences are gonna help shape your future, and you don't know until you really get out there to what it's like. So that's what I recommend. Be like Philip Chow.
No, no, no. Hey, thank you so much, Dr. Lou. This has been fun. Like I told you, this is more of a conversation between old friends than it is really anything else. And I hope the students viewing on YouTube Live have gotten something out of this conversation. Dr. Lou is not only an alumnus of Beckman High School, but he's been speaking with our program, I believe, for the last 3 or even 4 years. So if you're in our program, you are most likely to hear from him more at a later date in an in-person seminar. But other than that, Dr. Lou, thank you for your time. Thank you for your service. Thank you for being a hero to all of us during this pandemic, for all the sacrifices you've made. And thank you for continuously inspiring really our next generation. All right. So without further ado, I believe we're done. Thank you so much.
Thanks, Phil. It was great.